Okay, I think we are okay to start. Great. Thank you everyone for joining us. I'm Heather Page with UNSD, and we are beginning session 3, which is on intersectional and disability data sources for more equitable and inclusive data systems. And we're delighted to be here with you all in person and online. So as part of this, we have a part 1 and a part 2. So for part of our first session, the part 1 of this session, we'll set the scene by introducing the concept of intersectionality with a specific focus on how it relates to qualitative data. So just a few housekeeping items. This event will be recorded. International sign interpretation and captions are provided. The international sign interpreter is spotlighted, and the captions are available by clicking on the closed caption box on the bottom of the screen. So this is a hybrid event, and for those following online, please pose questions at any time in the chat. And because we tend to not have a whole lot of time for Q&A, we will also collect a lot of those questions in case they are not able to be answered live, and we'll pass them to the speakers as well. So without further ado, I will pass over to Francesca Perucci from Open Data Watch, who will set the scene on intersectionality and citizen data. Thanks so much.
Am I on? Yes. Okay, wonderful. Thank you so much, Heather, and welcome back from your lunch, and welcome to the newcomers for the afternoon session. The room has changed a little bit since the morning, and I'll introduce the general ideas behind intersectionality and how we framed it and how we plan to do the work within the collaborative. Just to say that Elizabeth Lockwood and myself are leading the work together for this work stream of the collaborative on citizen data. And I have a PowerPoint, and I'd like to show a few slides just to put things a little bit in perspective. The reason why we talk about intersectionality, well, the idea behind this, the approach to intersectionality, and especially when it comes to data, is there was a strong push, as you probably know, during at the beginning of after the agenda for the 2030 agenda for sustainable development was adopted with the new principle of leaving no one behind. There was a strong push for data disaggregation, we used to call it back then. I think we moved away quickly from the idea of data disaggregation, and we now talk more broadly about inclusive data systems. So really looking at the way people experience their lives and at the intersection of different aspects and different identities, and how data and data solutions can address those ideas. And can I have this PowerPoint?
Yeah. Oh, is the one?
No.
Raquel said it's still being uploaded.
Oh, still being uploaded. Okay. And anyway, so what do we mean when we say intersectionality? It's really about understanding people's lives and how they experience their lives as a result of their multiple identities. And we've had already a discussion this morning in the two previous sessions on, even when you look at gender, of course, there are so many other aspects that come into place. And similarly, when you look at particular groups that have been often marginalized or misrepresented in data, for instance, LGBTQ+, they have often been invisible in data. But even within that group, there are multiple identities, right? There can be indigenous groups. There can be coming, from specific parts of the country that are more isolated, or there can be so many other aspects that go and intersect with those identities. So that's the reason why we focus on intersectionality. And at ODW, we have actually developed a framework to help us understand, and it will come up in a moment. Is it coming up or not? No. No, okay. I'll try to describe the framework that we have come up with without the PowerPoint. But basically what we look at data, and we look at the different dimensions that you measure with the data. And then we look at how those can serve the different policy issues that you need to tackle, and how you can bring together those different dimensions to address those policy issues. And then we look at the impact you can have with those data. So basically you have four pillars that underpinning the framework. The first pillar is about availability of data. So what data solutions do you need to have those data? And then how you ensure the strong link between those data and the policy issues, how you empower people and citizens. And again, we talked about that this morning, to really have agency in data, and how you build then a data system that ensures impact. So that's a framework. If we had the PowerPoint, you will see how we represented that, and how we have represented that also along the data value chain, from collection to publication to uptake to impact. And then at each of those phases, when we take an inclusive data approach and we focus on intersectionality, there are different concrete steps that need to be taken at each of those phases. For instance, the first phase on data collection, it's very important to work with those relevant groups on which we are producing the data. So together with the groups decide and have this agency to really, and feel empowered to really determine what needs to be measured and how it is going to be measured. And then you go to the publication side, the analysis and the release and the dissemination of the data. And again, there, it's very important that all those principles that we've been discussing this morning, for citizen data, for instance, are applied, so that the citizens and the particular groups that are participating in the data production have their data privacy protected. They have ownership of the data, etc. So, and as you move along the data value chain, you'll see that all those different phases, the concept of agency and having control of data, and having control how data are disseminated, how data are also used, and to the extent that they have an impact. Oh, we have the PowerPoint now. Okay. So that was the framework, and this is the data. This was the framework that I was explaining earlier, and this is the data value chain. And as you see, at every stage, it's important that citizens have agency. And these are the pillars I was referring to earlier, the inclusive policies, the data agencies, and the equitable data systems. The way we have approached this within the collaborative is really to look at what data systems we have to ensure that we really have the data to help us reduce inequality and to promote social justice. And what we have, of course, we see that data systems remain very inadequate to address those issues, and we need to really work towards creating solutions for intersectional data. Some basic requirements that I like to highlight is that we need data that really capture the lived experiences of individuals, especially looking at the intersecting of these different social identities. But we need the concepts and definitions that help us and allow us to do so, because often statisticians, I'm a statistician myself, coming from a very traditional background as statisticians, we have concepts and definitions that are very sort of predefined with very old approaches that are hard to change, right? So it's really rethinking those concepts and those definitions. And then we have tools, we need tools so that for citizens to really be empowered and become agents in data. Increasing the use of participatory and inclusive approaches and innovative data solutions. So we really need to think differently and change those older and more traditional approaches, including when it comes to data governance and having new approaches to empower people to have control of their data and to participate in the overall governance of data systems. And then finally, increasing accessibility. And when I talk about accessibility, it's really having data access for all, including those that are have disability issues, but also language barriers, and many other aspects that might make accessibility a little bit more difficult. Now, how can we build these data systems for intersectionality? I'd like to mention two of the main work streams. One, of course, is ourselves, the citizen data, and within the collaborative, how we work to really develop those tools for engagement and for citizens to really have agency over data. How we can collect the data using mixed methods, and I'm sure Kate will talk a lot about qualitative data, and how we build the principles and the data governance to empower citizens. But the first block refers to new work done also on household surveys. So ways to also improve the traditional data collection methods to make them more participatory and to allow us to introduce that intersectional approach to data. So identifying the needs, as I was saying earlier, when you look at the data value chain, really making sure that the data you collect are the data that are relevant to the people that are included in the process. And managing the data collection and sampling, questionnaire design, data collection with ethical consideration, and then of course all that also applies to data analysis and dissemination. And then finally, I'd like to say a few words about what we're doing. As I mentioned, we have this work stream on intersectionality. We are producing guidance on intersectionality and citizen data. It's actually almost completed, so hopefully we'll be able to share soon with the broader collaborative. We have already a very extensive guidance on qualitative data that also includes the aspects related to quality of qualitative data that you'll hear in a moment about. And then finally, we have a guidance on making surveys accessible that was developed by UNSD and colleagues working on household surveys. And I'll stop here and give it back to you, Heather.
Thank you so much, Francesca. I really appreciate you setting the scene, even without slides, but the slides were also great to reinforce a lot of these concepts and information that we will delve into a bit more in this session. So thank you so much. I will now pass the floor to Elizabeth Lockwood from CBM Global, who will talk about intersectionality data and current projects with a focus on persons with disabilities. You have about 5 minutes.
Oh, I'll be short. Thank you, Heather. I'm very pleased to be here. And persons with disabilities are inherently intersectional. So we find it very important to focus on persons with disabilities in this work. And persons with disabilities make up 16% of the global population. So we're talking about quite a significant chunk of people. Linked to this intersectionality guide that we're developing via the collaborative, we are producing a report with Open Data Watch and Francesca on persons with disabilities and intersectional data. And we have 3 case studies, and one of them is with Lauren, who will present later. And then we have 2 others. They were led by organizations of persons with disabilities, and they use intersectional data practices in their data collection. And I'll just briefly talk about one because we don't have a lot of time. An organization called Culture Center for the Deaf in Mongolia collected interviews with deaf women, over 100 deaf women, on gender-based violence for deaf women in Mongolia. And they did use intersectionality because this was quite important to see if this impacted the findings. And interestingly, what they found was that age, background, education, and location did not impact gender-based violence, but that it could happen to any deaf woman anywhere at any level, any kind of background. So I think that's very important and very important for policy change in Mongolia. And now there are more questionnaires more broadly for women with disabilities similar to this one being carried out. And so I think this is an excellent example of data to policy and actually showing intersectionality. And I will hand it back to Heather. Thank you.
Thank you so much. That was really fast. I feel like we missed some claps, so I'll just clap for you. Great. Okay. Thank you so much, Elizabeth. I think there will probably be more questions about some of the work that you're doing. So we will get to that in just a moment. I'll now pass to Kate Caldwell from the Northeastern University Pritzker School of Law, who will talk to us about qualitative data documents and the connection with intersectionality and citizen data. She also has a presentation, so hopefully we can pull those slides up. I'll pass it to you, Kate. Thank you.
Thank you so much. And just a point of clarification, it's Northwestern University. Sorry. Oh, that's fine. Oh, here we go. So my name is Dr. Kate Caldwell. I'm at the Center for Racial and Disability Justice, and I'm excited to talk to you about intersectionality and qualitative data. In particular, one thing that I think is really important is to recognize that intersectionality came out of Kimberly Crenshaw's work, looking at basically how women's experiences were being, in particular, it came out of bringing critical race theory to law and legal studies through the lens of Black feminist thought, and recognizing that we don't have these fragmented separate identities. Like we aren't just what, I'm not simply a white woman and a bisexual woman and a disabled woman. I am actually coming from a positionality of all of these intersecting identities. And my experience and perception of the world is informed by that, but also the way I'm treated by the world is going to change based on all of those identities. And so that's very much important to understanding at the very center of it, why intersectionality is so important. But also when we're looking through the lens, and I know I'm preaching to the choir here, of data justice, we're really looking at, okay, how do we take a human rights framework to the entire data ecosystem? And where these two come together, intersectionality and data justice, it allows us to reveal how these overlapping systems of oppression really shape the inequities in data collection, in algorithms, and in governance as a whole. And it is essential to ensuring that we have systems that are fair, that are equitable, and that are being held accountable, really, not just by governments necessarily, but also by citizens themselves, and that they have a role and a voice in the process, because at the end of the day, these policy decisions that are being made by this very data is going to be impacting marginalized communities most. And so it's so critical that they have a role in this process. And one thing I also want to shout out is there are intersectional methods, both quantitative and qualitative, at every step in that data collection process, from the very way you structure the question to the data collection methods you use, the methods of analysis that you use. And a lot of people aren't as aware of those exact methods. And it's part of the reason why we've been working on these reports to share some of the qualitative intersectional methods as tools you can use to make what you're doing even better, because that's really the goal here. So some of the benefits of intersectional data is that it helps to reveal these hidden inequities. It helps to center marginalized voices, specifically for policy design. It helps to inform fair design and reduce bias. And also it enhances transparency and accountability. And we sort of touched on that a moment ago, but I think the most important thing to highlight here is that intersectionality really challenges us to call attention to the power relations in this data ecosystem, and to demand more participatory and community-led approaches that citizen data really lends itself well to. And also looking beyond simply just the collection of data, but also to how it is being analyzed, and then how it is being used and translated, and ideally mobilized for communities to advocate and empower themselves. I also wanted to address some of the main concerns or critiques that we see that can happen when you do intersectional data collection, especially with citizen data. One thing is what you can call theoretical dilution, but at the end of the day, what this just means is some people can use the rhetoric of intersectionality, but not actually, they stop short of actually engaging with the reality, the lived experience of intersectionality in a very real world sense. And so here we see a lot of policymakers say intersectional, but their behaviors and the way that they're actually using the data doesn't fall in line with actual intersectional practices. There's also the concern about reductionism, which basically means oversimplifying the lived complexity of intersectionality. So you risk reducing intersectionality to simply an interaction, right? To simply those specific identity categories. I think this is what Francesco is getting to with looking beyond simply disaggregation to actually looking at what these intersections look like in the real world. And when we oversimplify these identities, that actually it loses contact with the critical roots of all of the things necessary for true data justice. Also, there's a risk of tokenizing marginalized participants by overemphasizing identity categories rather than seeing them as the products of relational power structures. And this is something that we talk about in disability all the time, especially when you look at the social model of disability. Disability isn't something that someone is or has or does, but rather it's society that's disabling. Then there's also the concern, I know I'll speed it up a little bit. I'm seeing the concerned face. Oh, so there's a concern, there's a risk of data misuse. So intersectional data can actually be weaponized by surveillance states exposed that and used to expose marginalized communities to further harm, something that we're certainly seeing a lot of currently in the US context. And if you want to talk about that, find me afterwards. A coffee, yes, for the coffee break. I have stories. And what we're seeing happening right now in DC around the 60-hour Medicaid vigil. Another concern is that the complexity of intersectionality can also lead to interpretive ambiguity, and policymakers may misuse intersectional findings unintentionally due to their complexity, or a lot of times oversimplify them for convenience. So, for example, with qualitative data, we see a lot of times policymakers love quantifying qualitative data, and so they reduce it, what is a rich lived experience, to simply a count. And it doesn't it's not how it's supposed to be used, and it doesn't accurately reflect what that data found. And so it's kind of a waste. We also, of course, see issues with data ethics and structural bias. So we can reproduce systemic inequities if we don't pair them with community-based and participatory approaches, hence the strength of empowering communities and engaging with them to collect citizen data. And then finally, recognizing our own positionality and using reflexivity. And this is something we discuss a lot in the reports. So without reflective practices, we risk reproducing the same power imbalances that we're actually trying to address. So let's talk about these upcoming reports that I'm very excited about. We have two of them. The first one, and really think of these as tools, really, and resources to help you do what you do well, even better. So the first one is a more abstract focus on approaches to qualitative citizen data, including an overview of what exactly is it in a realistic, non-hoity-toity academic ivory tower sense, but what does it mean to you and the work that you do, and looking at the 5 main core approaches to qualitative data collection, which includes ethnography, which is at the end of the day, it's immersing yourself in a culture, a community, community, a group, and really learning as much as you can from that inside, that engaged perspective. Narrative inquiry, which is tapping into the real power of storytelling. It includes participatory action research, which involves elements of participatory research and action research. Of course, both exist on a spectrum. Ideally, PAR, or participatory action research, is the coming together of that to have involved stakeholders also doing research that's going to actualize and advocate for a common goal that's identified by that community. And then we have photo voice and video voice. There's a lot of really fun methods here. And this speaks to a sort of, it's somewhat a storytelling, but it's in a way where communities are telling their own stories. And then finally, case study, which I know you're all familiar with, and we're going to hear some case studies later. But really, a lot of people use case studies, but a lot of people don't necessarily know about the methods that can help you structure your case studies. And so that's what that's focused on. We discuss ethics and data quality, some mixed methods research design, so how to bridge your quantitative and qualitative data collection. And there's 3 main structures for that, and it makes it really easy. And then some applied examples. The second report is focused more concretely on methods and strategies that connect to the approaches in the first report. And so it's looking at what specific methods, and at the end of the day, a method is basically a tool to help you do what you're trying to do. And so the main methods that we look at are interviews, focus groups, which are basically a group interview, a dynamic discussion rather than a static one. Observation and ways to structure observation so that you know you're getting the data that you need from that observation, because a lot of times it's not clear. You're like, I'm putting a lot of resources into this observation, but I don't know that I'm going to walk away with what I need to create that model or that training or whatever that end product that you want to do is. And so there's some methods you can use to help you do that. Narrative methods, and then also some fun digital methods that give some examples for how to tap into things like social media, as well as using other electronic and technological advancements in the work that you do. And then it ends with some applied strategies that, of course, are in accordance with the Copenhagen framework. But this is looking more at, how do you do recruitment and sampling? How do you do coding and analysis? And even if your organization isn't going to be doing those things directly yourself, you will be working, you're likely going to be trying to assess the quality of groups that have been doing that. And so you need to be informed about them so that you know whether or not they did that well, and so that you can actually provide technical assistance to help them do it even better. So that's pretty much what's in these reports that we're very excited about. And thank you so much. And I've included my email here. Please feel free to reach out if you have any questions or even just want to chat, because I love talking about data.
Kate, thank you so much. That was excellent. I think this first part was for setting the scene and really providing some really important information about intersectionality and how to approach this. So we want to just give a couple minutes in case there's 1 or 2 burning questions that you have, in particular for Kate by chance, before we get into the panel questions. Anyone? You can also hold your question for later. Anyone? Do you have a question? Okay, here, I'll bring you my mic.
Thank you so much. I had a question about capacity building for policymakers. If you've been engaged in any initiatives or any approaches you recommend. I mean, it is like understanding the different identities, especially within the LGBTQ umbrella, and then how those and intersectionality, it can just sound like a lot of jargon, but it's really important to understand the nuance, or we risk we really risk misrepresenting these populations in data systems. So any efforts to that end to engage with the policymakers?
Thank you so much. I think that's an excellent question. Kate or Francesca or Elizabeth, does anyone have a response?
Kate first.
Yeah, I certainly can. I work with policymakers all the time. That's one of the things I'm most passionate about. Part of the reason why is because I saw so many policymakers who were advancing legislation based on one person's story and not necessarily based on the research evidence. But also at the end of the day, research is a tool to learn about people's lived experiences and perspectives, and in essence, to tell their stories. But when you're just looking at one person's story at a time, rather than research that or data really that's reflecting the community as a whole, then you aren't going to be as effective with the policy making that you're doing. And so I think a lot of times talking to policymakers about the power of storytelling it can be a good way to get them to understand these experiences and perspectives a little bit better, because they see how that influences the job that they do, because a lot of it is working with narratives in a variety of different ways, if that makes sense.
Raquel, was there one from the chat that you want to showcase? Spotlight.
Yes, one of the questions is related to how citizen data can support health system resilience, especially in case of shocks and disasters such as COVID or other disasters, especially for vulnerable groups. So there are many questions, but I'll summarize with this one, which relates to what kinds of citizen data initiatives do you believe are most effective in rapidly assessing health facility readiness in these contexts, and how we can strengthen communication between stakeholders then to ensure inclusive participation and to produce high quality data. Thank you.
Go ahead, Elizabeth.
I can answer about COVID. During COVID, persons with disabilities were not being counted in data collection, and people with disabilities were dying. I mean, it was a serious issue around the world in the global north and global south. And so civil society organizations of persons with disabilities collected their own data, and we have examples of this. And then we use that data to advocate for policy change. And one example, and I'm sure Lauren and Pamela can talk about this more, was that there wasn't sign language interpretation or captions in the daily news briefings. So deaf and hard of hearing people didn't have access to vital information. And these deaf associations advocated, and then many countries ended up putting this in, and it's still being used today. So there's a great example of policy change from that.
Thank you so much, Elizabeth. Okay, so I am also the timekeeper, and I have to keep us on time. So Joe, do you mind holding it? Thank you so much. Write it down so you don't forget. So we're going to move to part 2 in our panel, where we're going to share experiences. This section, our speakers will share experiences from different perspectives, each with expertise in a specific area. And we'll explore data needs for intersectionality and how data is being used in practice. And we'll have this in 2 rounds of questions, time permitting. Okay, so I will first start with Phil Crahan. I hope I pronounced that correctly, from COPA Lab. All right, so Phil, what are the critical aspects of addressing the data needs for intersectionality in the context of the LGBTQ plus community? And how do you think citizen data can genuinely advance the agenda for intersectional data?
Okay, hi everyone. Listen, I have a long list of needs and gaps to get through, so please do keep me held to those 3 minutes. 2 minutes. Yes, I will speak quick. Yeah, there's a lot of data needs when it comes to lesbian, gay, bisexual, transgender, and intersex LGBTI people. As we say at COPPA, the demand and the expectation for data on LGBTI people far outweighs our actual supply of it, the availability of it, and that's fine because we'll get there. But and if we look around the world, what we can see of most data is that we can put it into 4 themes, 4 buckets, right? The first is legal data that looks at civil and political human rights. The second one is more citizen-generated data by LGBTI groups. It's qualitative data, focus group discussions, in-depth interviews, which shows quite powerfully the kind of the depth of the issues that they face. Another way, what we're seeing from, again, LGBTI groups is more quantitative data, surveys, of course, non-representative, convenience sampling, which still quite powerful. And then the last way is just larger general population surveys, maybe by the state, maybe by international agencies. This is good. It's more recent. It's a step in the right direction. Sometimes the way that they ask if you're LGBTI is just one question that says, do you self-ID as LGBTI? Which I think is a good example of being well-intentioned. That doesn't really get us far. It's not great. It doesn't allow us to disaggregate later on. A better method, a better way of doing this is asking about gender identity through a two-step method, sex assigned at birth, gender that you identify now, sexual orientation, a three-step method, do you identify as LGB, your sexual orientation, your sexual past, and then intersex status is a separate question. Do you have diverse sex characteristics? This is just one of the methodological considerations to take into account when we're really advancing this intersectional data. There are other methodological gaps and challenges, but I'm going to skip to other ones because there are many, and we really need to look at this through the data lifecycle as you started out. And we really, again, we have to just kind of admit that there's not a lot of money out there for LGBTI data. This is in a context of not a lot of money for all the issues that we work on. And even during a good day before the inauguration of this president in the US, which we can call a good day because there was more money for LGBTI data collection, there was more money for inclusive data systems. Even then, we had so little, and right now, in this day, it's not a good day. There's just not a lot of money, and it really forces us to be creative and innovative in terms of how we're looking at resource mobilization for data and how we plug that into systems. So other challenges include, well, actually, looking at the Open Data Watch framework, once we have the data itself, once it's analyzed, or once it's collected, there's this huge problem of uptake, how it's used, right? And here I can put LGBTI data into three categories of gaps, of challenges. The first is the fact that many LGBTI groups around the world don't actually have quantitative data analysis, so there's a skills gap. Another gap is, am I out of time? Okay, that's a gap. Another gap is how it's shared, in the sense that it's not really shared, and what we do is reinvent the wheel and we don't learn from each other. And finally, the biggest gap is a systems gap, in the sense that there's very little incentive from the state and the international finance institutions to incorporate LGBTI data from citizens into their policies, into their funding mechanisms. And that's something we're really trying to work on with COPPA Lab. We launched this program called Data Lift, which is partnering with a group on the ground and saying, actually, there is some good data to draw upon. And what we do is we analyze those data through an economic and socioeconomic lens. We sensitize stakeholders through data roundtables. We get economic stakeholders and others into a room to say, this is what we found, this is why it's part of your remit. We try to activate it domestically through policies and a new economic framing. And then finally, the last two things, and I'll end it at that, we really try to activate it internationally by pumping it into the diagnostics, into the processes of the multilateral development bank. So the World Bank and the Inter-American Development Bank, the Asian Development Bank, they all have so much money and it is locked away from LGBTI people. We are unlocking it with data. And then finally, we will create partnerships with statistics offices so that we can scale this up in the long term. Thanks for allowing me to go over, sorry.
Thank you, Phil. No, it's so hard to tell you that the time is up. Thank you so much. Yes, we can clap. We should clap. Thank you. Okay, so we just have a couple different questions. We're getting the perspectives, and then we're also going to get some of the recommendations from our panelists. So online, we have Elham Yousefian from the International Refugee Assistance Project. Can we see her? Okay. So the question to Elham, what are the critical aspects of addressing the data needs for intersectionality in the context of the refugees and displaced persons with disabilities? We can see you now.
Yes,
Thank you for joining.
I hope you can. Thank you so much. Can you hear me well?
Yes, we can. Thank you.
Okay, I'm checking the time. I'm trying to stick to my 2 minutes because I've been on your place of moderator and I know how tough that is. So basically, I wanted use this time to mention that forcibly displaced people with disabilities, including refugees and migrants, are often even overlooked in the intersectionality conversations. So when even in many cases that different identities are being listed to ensure intersectionality, we miss displacement, we miss migration status. So I'm very grateful for this opportunity and inclusion of this topic in this panel. I want to mention three main factors that I think one should consider when looking into the intersection of disability and displacement when it comes to collecting data, and how these three factors impact disability and displacement data. First of all, we need to remember that during the journey of displacement, before, during, and after displacement, people may acquire new impairment, or the existing impairment may be aggravated. So this is something that if we do not consider by collecting data or recollecting data, we may be missing intersectional approach to displaced people with disabilities. The second issue, which is important and needs to be considered when thinking about disability and displacement, is that people who are displaced face additional barriers because of the displacement, because of the status as refugees. And we can go into all different types of barriers, but I just want to highlight the institutional barriers. For example, in almost, I would say, all countries, refugees with disabilities do not have access to services on equal basis with nationals with disabilities. In many contexts, they do not even have access to disability certificates. And this is something that should be considered if we really want to be intersectional and comprehensive in data collection and do not leave refugees with disabilities behind. And finally, the third issue that I want to highlight is that refugees with disabilities usually do not have access to assistive technology, assistive devices, even more than other groups of people with disabilities. And that causes a lot, like different answers to data collection, because even many of them, have lost their assistive devices throughout the journey or cannot obtain a new one, or because the impairment has been acquired throughout the journey, they cannot get the assistive devices. That's why when we collect data on refugees with disabilities, we do not ask them that part of the question of Washington Group questions about even if using glasses, even if using hearing aids, because we take the assumption that they do not have access to those devices. So these are some of the challenges, some of the differences that intersectionality requires to consider. Over.
Thank you so much. I think what's so interesting about each perspective is that there's so much to consider and that we really have to do that work. So thank you so much, Elham. I'm going to go to our next panelist, Lauren Farovich from the Global Deaf Research Institute. Lauren, I have a question for you. Producing data for intersectionality often requires a partnership between civil society, communities, and national statistical offices. Can you share your experience with data collection in Ecuador and the partnerships established and subsequent outcomes? Thank you.
Thank you. Thank you so much. In Ecuador, we work on national data collection with deaf communities, and that taught us strong partnerships that are really important for intersectional data. We have three big things that stood out for us as an organization. First is the cost of interpreters. This is a major barrier. So if we want deaf people truly involved in data collection and leadership, we must find solutions, whether these are funding solutions or volunteer interpreters or government support. So the cost does not exclude people specifically. Secondly, intersectionality means recognizing diversity within the deaf community. We make sure to identify leaders for each group: deaf women, We also have deaf LGBTQ. We have deaf rural people, as well as deaf blind individuals and other different groups, because no one person represents the whole. The third one links to data collection. We convert findings into accessible one-page sheets, and then we share these, not just with the deaf organizations, but with larger organizations that also focus on LGBTQ, women, rural, indigenous, and many more other groups. This helps those organizations to include deaf people who share those identities, instead of adding more pressure on deaf-serving groups, which are often already thinly stretched. So this approach made the data more impactful, it reached more partners, and reduced the burden on deaf organizations themselves. Thank you so much.
Thank you so much. I think we also needed to applaud Elham as well. So I'm just going to add that as well. Okay, thank you so much. I think it's so enriching to hear the different experiences from all of our panelists. So I'm going to go to our round 2 questions, which are very much related to recommendations. And how do we bridge these gaps? How do we make sure that we walk the walk or talk the talk and walk the walk? So I will go to Phil again. Can you share suggestions on how NSOs and other stakeholders safely and effectively can collect data on LGBTQ plus communities in less welcoming and less safe environments?
Yeah, it's a good question. I think, though, if we start in where this is most challenging, most hardest, our imaginations run wild, and actually that causes a crisis of the imagination and stops this type of work. So I'll answer it by more focusing on where this is happening, where it is happening safely, and once we see like what is in the realm of the possible, I think we can see that there's a lot of NSOs collecting this data already. So we saw a good case study of Mexico, Colombia, Ecuador, Nepal. And when we look at that, we can see that some of those conditions include, of course, where there is a permissive law. So that includes no criminalization of LGBTI people, but also policies to protect them. We can also consider where there is a strong civil society who has already generated their own data, who has engaged in citizen generated data of their own, right? And then have they established a partnership with that NSO? And in some cases they have, and that's quite powerful. Other factors that you can consider where this can happen can include, where is like which NSOs have a high capacity, and the World Bank has its own index. I think it's called the SPI, that really shows the capacity of these NSOs to be generating their own data. What does it look like? Do they have the money? Do they have the technical power? Yeah, so there's some things, again, to shout out to where this is happening, and that's quite strong. It's something we're really trying to cultivate at CAPA. We brought together NSOs and the economic development community through this, we call it a consortium for inclusive data, because what has been missing for so many years is actual spaces where NSOs can learn from each other and where they can ask these development institutions for the financing to do this type of data collection. And that's something we've been convening for a few years now, and most recently in Nepal, we brought together 8 NSOs from Asia and 2 from Latin America for a South-South exchange to show how this can happen, how you can do it safely, ethically, and once you have the data, how you really use it. So those are some of the conditions that, where it's good to be doing this type of data collection. To more get to the question of the most challenging, what do we do in those situations? I would say, ask yourself a few questions. If you're in an environment that does criminalize or target LGBTI people in some way, ask yourself, is there data that's already been collected from LGBTI organizations? What does that teach you? How can you collaborate with them even more? How can you have conversations, consultations? And if after that you still have a need to work with an NSO on larger nationwide data collection, you should really ask yourself, what is the point of having those data? And part of that answer should always fundamentally be to protect the rights and inclusion of LGBTI people. If that's not part of that, then you might not need to be doing nationwide data collection with an NSO. It's a context by context basis, and again, I think it's really looking at safety, dignity, and the well-being of the community.
Thank you so much, Phil. I think these are just excellent considerations that we should all keep in mind. Thank you. I will now turn to Elham online again, looking again at kind of recommendations. So how do you think citizen data can really be the answer to advance the agenda for intersectional data in this area? And can you share some key recommendations on how to safely, effectively, and inclusively collect data on refugees and displaced persons with disabilities? Thank you.
Recommendations. Well, this is my basically favorite part of the conversations. First thing I would say for all of us who work on disability data, I want to start by asking that whatever research, advocacy, or capacity development training that you're organizing, making sure to include the different aspects, the different challenges of that refugees with disabilities face, and make sure that this is properly reflected in what we are doing. So I was just like listening earlier to Elizabeth talking about like guidelines on intersectionality and intersectional data. I'm like looking forward to make sure that, you know, refugees with disabilities and their concerns is properly reflected. So that's the first step. In terms of data collected by organizations of persons with disabilities, I think we really need to raise that awareness and sensitize organizations of people with disabilities that when collecting data on disability, they need to include that intersectional aspect regarding disability and displacement. And of course, to donors, to those who are funding this type of data collection, if the message comes from them, that when collecting data, also disaggregate that based on displacement, based on refugee status. And that would be a huge step and huge help. And in terms of safely collecting data, one thing that I really want to highlight is the fact that refugees with disabilities also face stigma. And you know, when this stigma is added up to the stigma or wrong attitudes toward disability, then refugees with disabilities face additional compounded stigma and false attitudes about their situation. And this is something that we really need to consider when collecting data. For example, family members may feel that if they share about the refugee having a refugee member with disability in the household, they will lose their chances of resettlement, which actually could be the opposite, but people may not have that information. But this is something that should be considered, that, you know, those numerators, when they interview people, should be aware of this stigma around refugee plus disability, to make sure that this is also considered in the way that the questions are asked and the language that is being used, and confidentiality and privacy. And finally, one more thing that I want to highlight is the partnership between refugee-led organizations and organizations of people with disabilities. This is basically, in my opinion, the solution to almost all of the challenges that refugees with disabilities face, because the reality is that organizations of people with disabilities have part of the answer, and refugee-led organizations have another part of the answer. And we cannot be making sure that we are inclusive, including in data collection, unless we foster exchange and collaboration between these two representative organizations. Thank you.
Thank you so much. Such an excellent illustration of the power of partnerships and how we can leap forward in this work when we're together. So thank you. I will now go to Lauren. From your data projects, what are some lessons learned on how to collect data from deaf communities that empowers the community and provides meaning? Thank you.
Thank you so much for the question. The heart of our work is focused on national needs assessments. We've seen huge benefits when deaf communities and deaf serving organizations are directly involved. And so we see when priorities are set together based on the findings of the data, It actually unites the community and helps everyone reevaluate their focus and to have a clear understanding. This process doesn't just help governments to make better policies, but it also in turn helps the deaf community itself to be more stronger and more unified and more empowered to be able to advocate more effectively. It's equally important to recognize that many deaf people face in education or have language barriers themselves. This means they often don't have the vocabulary or the experience to recognize the isms that they face, such as racism or sexism, or to articulate the discrimination that they face. And because of these barriers, the ideal approach is not to expect everyone to self-identify all the ways that they are excluded in the system. Instead, we need to have a look at the system to examine which services and resources they are available that is not being reached or included. We also encourage projects to go beyond just asking a few individuals and to analyze the environment. We ask the difficult questions. Who is accessing these services and who isn't? What are these gaps that we face? So the systems approach that we have makes it possible to address the exclusion, even for those who cannot name or recognize these barriers themselves. Finally, I just want to conclude to say it's critically important that after a project ends, the community is not left behind. We need to assign and train someone locally to share the findings and educate the local community, which in turn increases the transparency and ensures that the project has lasting impact. When the community is part of every step and equipped to use the data, they are able to keep advocating themselves and to push for real change.
Thank you so much. That was excellent. We need a guide just for the session. It's like, these are the questions that you need to ask and the things that you need to think about. I think this is a lot of food for thought, taking back to the work that we all have. So thank you so much for all of the enlightened experiences and recommendations that you're sharing. So we will next pass over to Pamela Molina, who is from the World Federation of the Deaf and the International Disability Alliance. And Pamela will present on the organizations of persons with disabilities and intersectional data processes, as well as findings and lessons learned from a case study in Bolivia on deaf indigenous women. I'll pass it to you now, Pamela. Thank you.
Thank you. Good afternoon. She already said I'm representing the International Disability Alliance and the World Federation of the Deaf. So we need to strengthen data on persons with disabilities, following and being in line with the UN Convention on the Rights of Persons with Disabilities, Article 31, and also the 2030 Agenda, SDG 17.18, to ensure that persons with disabilities are included in the data value chain. And they must be counted fully in the entire process. And we have to show the reality and the life of persons with disabilities to affect policy change. But unfortunately, persons with disabilities are one of the groups most left behind in the implementation of the SDGs, with only 3 global SDG indicators having enough data to be disaggregated by disability status. So for that reason, we support using and recognizing citizen data especially citizen data led by organizations of persons with disabilities, to complement key critical gaps on persons with disabilities. So now I'd like to share with you an example of deaf-led data collection on deaf Indigenous women in Bolivia. This was a project that was funded by CBM Global Disability Inclusion. We have in the world more than 70 million deaf people. And I actually think it's more, but we don't have the data for this. So even with this many people, we don't have data that capture the lived experiences of deaf people and their barriers. And especially looking at signing deaf people, there are no data. We look at, we don't have surveys do not have national sign language, and this is why. So we're missing the deaf perspective, and there's a lack of deaf cultural awareness as well included in surveys. So as a result, the World Federation of the Deaf supports deaf-led research to collect data on deaf people, because otherwise we wouldn't have this information in this data. The World Federation of the Deaf has led citizen data and intersectional data in Bolivia, and the focus was on barriers for these deaf Indigenous women and how they encountered and accessed healthcare services. The data collected were quite powerful because the women are one of the groups most oppressed and discriminated in the country because of their intersectionality. Looking at gender, indigeneity, and deafness, and being a minoritized language user. All together is an intersection of discrimination. The findings brought together, we interviewed these women, surveyed them twice, 20 women, and some of the findings I'll share now. Most of the women were born of hearing families without any access to sign language in the home. Because hearing families stigmatize deaf culture and sign language, and so they are resistant to learning sign language. These women did not have access to sexual and reproductive health education at all, and most of the women were in impoverished settings with limited access to education. A little bit more than half of these women interviewed had access to healthcare insurance, but they still didn't understand basic family planning because they didn't have education in this, and many had unintended pregnancies as a result. Most of the barriers were communication barriers because of lack of information in sign language and lack of interpreters. And so most of these women they missed critical gaps in sign language to healthcare access. So we gathered testimonies from these women, and they are so powerful. And to look at the intersection and the oppression of these women. All of these women interviewed were victims of rape and abuse. And this was just said recently that they didn't even recognize that what was happening was abuse. And so they were victimized of this from language deprivation as well. And often they were family members and intimate partners who were the ones abusing these women. These women did not have access to healthcare information. They were victims of this as well. They had high risk of stigma and oppression and discrimination because of their intersectionality. All of these women didn't have they didn't have opportunities of support in their national sign language, Bolivian Sign Language in this case. And they had to depend on their family members and friends to get information about health. And they had to depend on family members to be their interpreters for healthcare appointments. And this is a violation of privacy. And often, the family member who is accompanying this deaf woman could also be her abuser. There were many instances of misunderstandings and feelings of isolation for these deaf women, especially at home within their families due to communication breakdowns. And all of these women were very eager to participate in educational trainings to understand more about sexual reproductive health and to participate in workshops, and especially through Bolivian Sign Language. So it shows the importance that we provide cultural awareness and trainings through national sign languages. And especially in this case, Bolivian Sign Language. This is a great example of citizen collected data because we wouldn't have gathered this information otherwise. So it's new information, and we highlighted barriers and gaps that truly can impact policy change. And finally, I have recommendations. And just listening to all of you, I added just 2 more. But generally, when we look at citizen data collection, specifically looking at developing partnerships with national statistical offices of these data projects, it's very important that you include organizations of persons with disabilities and deaf associations in this process, in the design process, through implementation in the entire data value chain, including data collection. This is very important to have the disability. And additionally, we need to have disaggregation of disability included in these projects as well. So when we're looking at disaggregation, we have to also include national sign languages. They have to be included as well as another category because national sign languages are a minoritized language. And the other recommendations we have, governments, they must, especially ministerial health departments, they have to receive trainings from the World Federation of the Deaf, along with FEBOS, which is the Federation of Bolivian Sign Language and Deaf Association in Bolivia, sorry. Yes, we need to partner together to provide training to ministries, health ministries in Bolivia, to provide the highest quality of services in healthcare settings for deaf patients and others, but especially looking through that intersectional lens. And we also need to include deaf awareness and deaf cultural awareness and intersectionality in this, especially through Bolivian Sign Language. We also recommend a workshop on health for deaf women themselves, specifically deaf Indigenous women. And especially because these women are often remote and isolated and not in one location. So it's really important that we have these workshops such as sexual reproductive health, family planning, so these women can empower themselves, have the information to really share with each other and take ownership of their lives and their health. And finally, we have to develop anti-audist and decolonial policies in both medical settings, hospitals, and schools. And we really need to do this through the direct participation of deaf professionals, deaf people who are skilled, who can also incorporate intersectionality to avoid bias and gender bias. Thank you.
Thank you so much, Pamela. I'm still trying to keep us on track. I just want to thank everyone for such a rich conversation, actually, and providing so many perspectives and recommendations that we can all take away in the work that we're doing. So I wanted to give Jo a chance for her question, and then we will wrap up with conclusion and next steps from Francesca, and then you can go to your coffee just a couple of minutes late. I'm sorry. Thanks.
Thanks so much. It was really a sort of practical, factual question, which is, you know, that gap's the wrong word, the connection between quantitative data that points to scope and scale and the value of quantitative data and stories. Will the guidance that is being prepared give some really sort of concrete and specific examples to people who recognise the importance of both, and a range of ways in which the, you know, like purposive sampling, working with and through communities that are experiencing multiple marginalisations, can be combined to provide greater insight when you don't have big enough data set to really see some of those insights and you want to protect for all kinds of reasons. You know, I think there's some really powerful and important questions that come here practically for those of us who want to do that, and who want to do that in ways that are meaningful, so that you're not loading small groups with the weight of expectation for doing this work, but on the other hand, recognise that, you know, not giving visibility to the multiple marginalisations is a problem. And yeah, so it's a question about practical guidance and how to do that, I think.
Practical guidance. You want to address?
Will the guidance give that sort of detail?
Yeah, I think Kate is in the best position.
I think it comes down to when you use qualitative versus quantitative methods, and when and how you use the two together, so that in those mixed methods designs, when the one will lead into the other. So for example, for a hard to measure population or a critically under-researched population, that really lends itself really well to qualitative methods. And if you want to then connect that to quantitative methods later on, you need to really think of it in that way, because otherwise the one won't necessarily lead into the other unless you intend for it to. And there's a lot of qualitative researchers who do wonderful qualitative research, but it won't necessarily lead to quantitative developments unless you specifically structure it that way. And there's some ways to do that wonderfully. And I know earlier I talked about trying to resist the urge to quantify qualitative research, but that doesn't mean that qualitative research cannot be used to develop models that can then be tested, or instruments for quantitative data collection later on. In point of fact, they should. And so I think it's really about how you structure the transition between the two and when you use qualitative versus quantitative. But then also sometimes you collect quantitative data and it still doesn't give you the full story, because there's limitations on what questions you can actually answer with that quantitative data. And so then you're going to be like, okay, well, here's where I can use qualitative data to really dive deeper into what's actually happening to help illuminate what the numbers are telling us, right? So, and yeah, we do talk about that in the reports. Yeah, but I think it's also an ongoing discussion as well.
Thank you, Kate. We are so out of time, and I'm so sorry, but I'm going to pass to Francesca for just a few key quick takeaways. And then I'd just like to give one more huge round of applause to our panelists and thank them for such an amazing session. So Francesca, last word.
Thank you. Yes, super quick, but just a few quick takeaways. I think this has been amazing, and just listening to the panelists, I've learned so much. But I think what I take away is that somehow everything I've heard confirms what we've been trying to do, Elizabeth and I, with the framework, and how we try to address intersectionality within the collaborative on citizen data. And that is so important to focus on every step of the data value chain. And we heard, right, from all of you, especially the beginning and the end. Of course, everything in between is important, but really what you measure, how you conceptualize it. And it's not so important to have large scale data sets. It's important to really understand the critical issues and what the lived experiences are at the intersection of those multiple circumstances and identities. And the end, and we heard, how you connect with the policymakers. How do you really make sure those data are used for what you want to see happen, right? That's the critical aspect. And then another takeaway is the financing aspect. We've seen that all of this is the part of the data sector that is the most defunded and the most at risk of continuing, to lose funding and to lose the support that you need, both at the global level, at the national level, at the local level, at every level. It's really critical. And so that's, I think, our guidance and our work from the collaborative also has to include that. Sensitizing, advocacy, really keep giving that message that this is all so important and so critical, and it has a tremendous impact, both positive but also negative, when you don't have, you continue to have those data gaps and you don't have the information that you need for those changes that are so urgently needed. Back to you.
Thanks so much. I think we have about 8 minutes for coffee. So thank you so much. We really appreciate it.